of several characteristics. Among them are gestational age, time point of assessment, but in any case of bronchopulmonary dysplasia, there should be the history of the treatment with oxygen greater than 21% for at least 28 days. And depending on their need of subsequent oxygen therapy at definite concentrations, we distinguish several forms of BPD, mild BPD, moderate BPD, and severe BPD. And all patients who are included in our study had severe form of BPD. Since advent of surfactant, the pathomorphology of bronchopulmonary dysplasia has dramatically evolved. A classic bronchopulmonary dysplasia is characterized by metaplasia of the respiratory epithelium, smooth muscle hypertrophy, significant fibrosis of large vascular modifications. And new bronchopulmonary dysplasia has milder changes, less hypertrophy, less fibrosis, less severe squamous metaplasia, but dysmorphic pulmonary microvasculature and increase in elastic tissue are present in this group of patients. Well, roughly speaking, the treatment of bronchopulmonary dysplasia, the treatment of pulmonary hypertension. Pulmonary hypertension is very severe complication of bronchopulmonary dysplasia. And there have been proposed several groups of medications to palliate this condition, this previously known fatal condition. Among them are endothelin 1 receptor antagonists, prostacyclin analogs, calcium channel antagonists, not some kind of novel therapies, inhaled nitric oxide, and the last group, phosphodiesterase 5 inhibitors. And among them is sildenafil, which is widely known to treat erectile dysfunction in male adults, as Viagra. So, interestingly, phosphodiesterase 5 is highly expressed in pulmonary artery smooth muscle cells, as well as in hypertrophied human right ventricle. That means that we can prevent some kind of remodeling in the right ventricle. So we can treat cor pulmonale with sildenafil. Let's move on to our study design. It is a retrospective study from 2009 throughout 2012, which included 10 patients, 8 males and 2 females, with a gestational age ranging between 25 to 41 weeks, with a mean post-conceptual age of about 52 weeks, duration of mechanical ventilation and initiation of treatment ranging between 8 and 99 days. And in 90% of cases, we had a classic form of BPD, and only one patient had new form. Severe bronchopulmonary dysplasia was observed in 10 patients, as I already mentioned earlier, and the majority of patients had the second degree of respiratory failure. Inclusion criteria was pulmonary hypertension based on echocardiographic evaluation. So it is an elevation of systolic pulmonary artery pressure greater than 30 millimeters mercury, or which is most important, which is extremely important for pediatric patients, their ratio of pulmonary to systemic systolic blood pressure greater or equal than 0.5. To measure systolic pulmonary artery pressure, we used echocardiographic method, and we assessed tricuspid regurgitated jet velocity. The exclusion criteria was complex congenital heart disease, that is any lesion other than atrial septal defect, persistent form anomaly, or patent arteriosus. The clinical effectiveness was reached in patients with a 20% decrease in this ratio after sildenafil treatment. The dosage. At initiation, it was 0.5 milligram per kilogram per dose every 8 hours. Then it was increased to achieve desired clinical effect based on the echocardiographic criteria I mentioned earlier. So the maximum dose was about 2 milligrams per kilogram per dose every 6 to 8 hours. The results. Here you see the absolute quantitative decrease in this ratio after the sildenafil treatment in all patients. And it is also important to mention that the median duration of sildenafil treatment was 5.5 months. Here's another diagram showing the same. decrease. Hemodynamic improvement was achieved in 90% of patients. Here you may see their change in oxygen saturation after their treatment with sildenafil. And unfortunately, 2 patients subsequently died due to multi-organ failure. The conclusions are, this is the first sildenafil study which almost exclusively enrolled infants with classic form of BPD. Sildenafil treatment of pulmonary hypertension of infants with BPD is both effective and safe, and which I think is most important now, some prospects about the treatment of this condition. So additional trials should be conducted to evaluate the efficacy of sildenafil in combinations with other drugs, which I also already mentioned in my presentation. For example, with bosentan, which is an insulin-1 receptor antagonist. So that's it. Thank you so much.
Okay. Thank you very much. It's a brighting future for Weimar. But yes, okay, I think it was an excellent presentation. Any question, remark?
Did you observe some side effects of the treatment with sildenafil?
No, we didn't observe because maybe it's because we had a small group of patients, only 10 patients. But 2 patients, as I said, they died due to multi-organ failure, which we do not associate with their sildenafil treatment. But as far as I know, some international data regarding the treatment with sildenafil of pulmonary hypertension in patients with new form of bronchopulmonary dysplasia. So they report recurrent side effect, which is also known in male adults. They recurrent erection, so report recurrent erection. Like Stephen Abman from Colorado, Denver, he reported 2 patients from a group of 25 patients. So it's interesting.
But I think it's not real side effect. It is another effect.
Yes. Yes.
Can you go back to the slide results?
Okay, first, which one?
Second?
This one.
Yeah, with the, hemodynamic improvement, okay. And what do you mean, like the...
Hemodynamic improvement.
Yeah.
It's 20% decrease in the ratio of pulmonary to systolic arterial pressure. So, because you know, if we use just this, this or this data, they are not just relevant because it is absolute quantitative reduction, but we should know the ratio. Because, for example, if you have an infant of about 500 grams and he has a reduction of like 10 millimeters mercury, is it enough or not? You should know the percentage. So that's quite easy. Yes?
How long should you use sildenafil treatment? It's a theoretical lifelong therapy because the duration was 5.5 months, but theoretically you should continue this therapy.
Yes, it is the medium duration of sildenafil treatment, but during the follow-up they also continue to use it. Yes, please.
What was the basic condition of these infants? So the disease which results in BPD?
So you mean the...
Probably in the neonatal period. Because a little bit hard to recreate patients with classic form of BPD.
Okay.
And the gestational age range was pretty high, so
well, actually...
a lot of term or near-term infants was enrolled into this study.
Oh, actually I want to add that, as you already mentioned, we had like 90% of classic form BPD cases. Unfortunately, it is maybe a shame on Russia because surfactant has appeared a long time ago. And unfortunately, in many hospitals, we do not have a surfactant to treat this condition. And that's why we had the chance to treat the bronchopulmonary dysplasia in patients with classic form BPD. And the range is very high, but you know, the definition of pulmonary dysplasia is very challenging. So, and not in every hospital they know this disease. They recognize it. That's why we collected all the patients all together and made this retrospective analysis.
Okay.
Yes, good.
I have a theoretical question.
Yes.
Among the treatment options, you mentioned the inhaled nitric oxide.
Yes.
Is it clinically available?
It is clinically available, but it is expensive and not. I don't know the situation in Europe. I think it's better here. So Western Europe, maybe here. But even when we started this therapy, it was available in one center, but unfortunately it wasn't our one, so we couldn't afford it.
So in our clinic we just
Launched this?
try
Okay.
this treatment option for myocardial infarction.
Oh.
So the so-called NOMI study to try to inhale nitric oxide to evoke cardioprotective effects.
Okay, and
So the theory, the pathway is the same. So with NO you can trigger the production of CGMP, cyclic guanidine monophosphate, and sildenafil blocks the degrading enzyme of
Yes.
CGMP. So you can
Combination.
stimulate the same pathway. And if you can add these two treatments in combination, perhaps you have additive benefits.
of course, they work synergistically. And additionally, sildenafil increases their effects of exogenous nitric oxide. So it has a direct also effect on it. And there have been reported some data regarding, international data regarding their combination therapies with inhaled nitric oxide with bosentan, and they're very promising. So I think in nearest future we'll have a chance to do this.
Okay, thank you very much. We have learned a lot. Okay, then I will close the session. We will just to make a short break.